Hi everyone, I'm Dr. Sushma, consultant pediatric rheumatologist, Chandri Rheumatology and Immunology Hospital, Bangalore. Today we are going to talk about childhood arthritis. So we think that arthritis is a disease of elderly, but it is not so. It can happen in children as well. Just yesterday, on the 18th of March, every year, we observe something called as World Day, wherein that is the World Young Rheumatic Diseases Day, where we spread awareness that this arthritis can happen in children as well. So, what is this arthritis and why should we be worried about it, and what are the things we should know? Let's learn more about it. The awareness among this is quite less, even among the medical fraternity. So, arthritis can happen in children. So, when it occurs in children lesser than 16 years of age, we call it as juvenile arthritis. It is not a infection or a disease of degeneration. It is a problem with the immunity that is causing inflammation in the joints. So, let's learn what is inflammation. So, inflammation is the normal body's response to any infection, injury, or any harm. So, it is a normal response. So, when we have a cut or injury to our hands or fingers, we see that there is redness, warmth, swelling, and pain. These are the features of inflammation. So, if it is localized to one particular part of the body, that is acts as a normal defense mechanism against any injury. But if it occurs throughout the body, we call it as systemic inflammation. So, arthritis is a certain type of inflammation that happens in joints, especially in the lining of joints. So now we have joints are formed by two bones, and the lining of the bone within the joint is called as synovium. And we also have some fluid inside the joints, and it is very minimal in quantity in a normal healthy joint. So whenever there is inflammation in the joint, that can cause this synovium to become more active, and it becomes bigger, and it invades into the bone and causes destruction of the bone. This is called as arthritis in the joint. If the same inflammation or these bad immune cells, they proliferate, they become more in number in our blood circulation, it produces something called as systemic inflammation. So let's learn what is this childhood arthritis. So we must know that our immunity is like a storage system that has army or the soldiers, they are loaded with weapons. Whenever there is an infection or an external injury, or like for example, a bacterial infection, our soldiers, the white blood cells from the storage, they come out of the storage and start acting against those particular pathogens or the bacteria. And to target that particular type of bacteria, our white blood cells release certain types of weapons that are very much targeted to those, like we call it as antibodies or cytokines. And that's how it kills the bacteria and protects us from the infection. This is a normal immune response that happens in everyone. But sometimes in children, it can get dysregulated, as in the switch to turn on this immune response can be turned on without any actual trigger. So when there is no infection, in reality, body thinks that there is a harm from outside and goes on to fire these white blood cells and goes on to fire those weapons called as antibodies and cytokines without any actual trigger. And it forgets to switch off this trigger, and it can happen episodically also, like the immunity gets triggered on and triggered off without any actual reason. So when it triggers on without a reason, it can go on to affect certain joints. It can affect any joint. We have subtypes of arthritis, like we call it as in young children, 2 to 5 years of age. There can be a single joint or a less than 4 joints involvement. We call it as oligoarthritis. It just means that the lesser number of joints are affected. It can affect only the joints. Sometimes in older children and also in younger children, it can affect multiple joints, especially the smaller joints. Also, in certain subtype of arthritis. We call it as systemic arthritis. It not only affects the joints, also affects our body as a whole. So the child might have fever, rashes, like there is enlargement of the lymph nodes around the neck, and also hepatosplenomegaly that we see on examination. So we learned what is normal immune system and what is essentially wrong in juvenile arthritis. Let's learn why should we know all these symptoms? Is because these symptoms are very subtle and can be easily missed. So early intervention, early diagnosis and intervention is a very important thing in immunological conditions because it gives us a window of opportunity called as the immunological window, the golden time wherein if we intervene at that particular time, the control we achieve is very faster, and also we can do that with lesser number of drugs. And if it gets little delayed, the joint destruction might have set in, and also we do not have those active cells to target on, so we might miss on the golden opportunity. So as the symptoms are very subtle, we need to know these subtle symptoms so that we can act in time. So the symptoms can be joint pain or joint swelling or stiffness in the joint. So this joint pain is more in the morning when the child wakes up, and a child may refuse to get down from the couch because of pain, or child might walk with a limp. The limp can be very subtle, which can be missed if not seen keenly. So and joint swelling can also be mild or it can be too big. And the stiffness, what we are talking is that the child refuses to use the limb after waking up from the sleep, at least for about 15 minutes. Only after that period of time, child is able to resume its activity or get down the couch. Or even after a prolonged sitting, for example, sitting in a class period or sitting in a theater or sitting in car, also makes the joint stiff and unable to relax or bend or straighten the joints. This we call it as stiffness or gelling of the joint. That is a very predominant or a very particular symptom of juvenile any inflammation in the joint. So this sort of stiffness in the joint or pain in the joint is very important. And one more important thing to remember is that the joint pain can be very minimal, or the child might not even complain of the pain, or can go on to just limp in the morning and be totally fine. So that is one thing. And severe pain is not very common in inflammation as such. But if there is a severe pain, we'll have to think of other causes also, which need to be picked up in time. So one more thing in children is that in younger children, especially 3 to 8 years of age, so growing pains is another concern. So growing pains are very common among children. So how do we differentiate between pain of arthritis or that from growing pain is very important. When in doubt, always reach out to your pediatrician or a pediatric rheumatologist. A pediatric rheumatologist is someone who specializes in the field of these diseases dealing with immunity. So a growing pain is when a younger child, after being totally active during the day, doing all the activities and sports, and at the end of the day, while going to sleep, complains that there is pain in the legs. So severe pain that he might wake up from sleep and start crying because of pain in the legs, especially in the thigh or the shin, not particularly the joint. And after a period of gentle massaging to the legs, child may be relieved of the symptoms and can sleep. But when they wake up in the morning, they're absolutely fine. This is very important in growing pain. But if the child complains of pain that persists even in the morning, we should think of something apart from growing pain that could be a feature of arthritis. And also, there can be systemic features, as I told you. in particular subtype of juvenile arthritis called as systemic arthritis, there can be fever. This fever need not be present throughout the day. It is usually seen in the evening hours, 1 or 2 spikes per day. It can be high grade fever, and child might complain of symptoms of bone joint pain and decreased energy and fatigue only during that period of fever. And throughout the day, when there is no fever, child can be absolutely fine. So, having poor energy and refusing to do activities like before, or being very tired, and having this fever, and also that we can observe certain type of rashes during the period of fever, and these rashes might disappear when the child is not having fever. The rashes can be red patches that appear on the arms, chest, trunk, legs, and these fade off when the fever is not there. Also, because of the complexity of the skin, these rashes may not be very evident as well, and the parents might feel that there was never a rash. Only on careful and thorough physical examination, we might find it. So, if the fever, usually when there is a fever in a child, we think it is some infection, mostly a viral infection. But if it is a viral infection, as the day progresses, the fever intensity and the frequency should come down. And fever is usually continuous in viral fever, unlike as in systemic arthritis. But if the fever persists for weeks together, at least a week, and the child has very low energy during those periods and is very tired, or has any type of redness of in the skin, or any rashes, or any joint pain, one must think that it is something beyond infection and has to reach out to a pediatric rheumatologist. So there can be systemic features, like I told you, and also the child might not eat like before. There can be poor appetite and also a loss of weight. Also, this could mean something other than the immunological diseases. Also, it could be something serious as well. But everything needs to, we have to report to the doctor so that we can know what it is, if it is an infection or an inflammation or something more serious or sinister, like a cancer. So that, which is very rare in children. So it needs to be reported, knowing those symptoms, and knowing that it is not a growing pain, and knowing that all fever is not infection. We'll have to like, if it is not responding to antibiotics, we'll have to think beyond infection. And knowing the subtle features of joint pain and joint swelling and stiffness are very important, so that you can reach out to a pediatric rheumatologist. So when you reach out to a pediatric rheumatologist, we take a thorough history and a physical examination. Since no investigation can diagnose this disease and say that if that turns out to be positive, you have this. We don't have such investigations. But with thorough physical examination and good history, one can diagnose these problems. And during the physical examination, and we might find that there is minimal joint swelling, or just some fluid in the joint, or any inflammation in the joint. To pick up those subtle features, as I previously told you, the inflammation in the joint can be very subtle and has to be seen by someone who has trained in this particular aspect. So if I mean to say that it can be easily missed. So when we do a thorough physical examination, we look into the musculoskeletal system of the child, where we see how is the joint, if there is any effusion or a fluid inside the joint, and how is the joint mobility. We look for lymph nodes, the liver and spleen size, and overall examination of the child. And when we diagnose this, it could be a systemic arthritis, or a oligoarthritis, or a polyarticular arthritis. Polyarticular arthritis means that it is multiple small joint involvement. So we tend to do certain investigations. We do a complete blood work, and we to see how is the white counts, are they high or low, and also we tend to look for diseases other than these inflammatory diseases as well. And also we do a peripheral smear to look for any abnormal cells in the blood, and we do certain type of blood work to see the immune response in the child, as in how active is the inflammation. These are called inflammatory markers. We do a CRP and a ESR to see how strong is the inflammation that is going on. And after doing this, and there are certain immunological tests as well that we might do uh, depending on the type. And we have to know that in a particular type of arthritis that I previously mentioned, or the oligoarticular arthritis, we do a test called as ANA. ANA means anti-nuclear antibody. So it can be normally found in less than 3% of the children, but if it is found in high titer in children with oligoarticular or like less than 4 joint involvement arthritis in younger children, we have to be very cautious in that this arthritis can go on to have inflammation in the layers of the eyes as well. So we do not know the reason why it can happen in the eye as well, but the chances of having inflammation in the eye called as uveitis is way higher. So we do this immunological test called ANA, and we see the titer in which how strongly it is positive. And if it is positive, we go on to frequently monitor these children with regular eye screening, initially once in 3 months and later once in 6 months till the age of 10 years, so that there is no inflammation in the eye. If there is inflammation in the eye, we'll have to start on medicines to control those particular types of inflammation. And other types of immunological workup may include HLA-B27 or a rheumatoid factor, depending on the subtype of arthritis that we are dealing with. So there can be certain questions like HLA-B27 being positive. So these are not, we can't say that the arthritis are genetic diseases, but we do see certain clustering of arthritis in certain types of arthritis. For example, this enthesitis related arthritis, wherein we have this HLA-B27 positivity, can be positive in other family members as well. So, father or a uncle, it can be positive. There can be very subtle clustering of arthritis among the family members as well. And even in psoriatic type of arthritis, wherein there is arthritis and there is skin rashes that has peeling of skin or whitish or silvery scaling or peeling of the skin, drying of the skin, especially in the winter. Or if you know that there is history of psoriasis in the family, it can get clustered in the family. So the family history of psoriasis becomes important here. So after doing these immunological tests, if at all we are not sure if there is any mild inflammation in the joint, or we might go on to do certain imaging tests. Also, when we think that the joint damage is very aggressive, or there has a destruction that has happened before you reach out to a doctor, we might go on to do certain imaging investigations. So we can do an ultrasound of the joint to see how much is the fluid that is accumulated, and also we see the joint lining that we previously spoke about, how thick is the joint lining and how much it is invading the joint. And if the disease has progressed very much, and if there is a destruction in the joint bone already, we do X-ray or MRI depending on the situation and see how destructive is the arthritis. And after this, regarding the management. So we can't say that we can cure this disease, but it can definitely be treated. So this is a problem with the immunity. It is not a problem with the bone or the joint, or it's not any infection. It can get switched on and switched off, depending. Sometimes even certain infections can trigger this switch. So even if it is calmed down or controlled now, it can go on to get switched on later, but that is a probability. But with correct treatment and early intervention, we can totally control the disease we can totally control the disease. When I mean that we can totally control the immunity, which is on a overdrive in these types of arthritis. So management, it is not just the medicines. Along with medicines, we have physical therapy, and also good lifestyle will help in the management. So the medicines, we have certain types of targeted therapy, as in now with advancing science and technology, we know what particular type of weapons are on overdrive, or which particular type of antibody or a bad immune cells are on overdrive. So depending on the subtype of that particular type of arthritis, we might go on to choose that particular medicine that might target those particular bad immune cells. So we do have plenty of options to control these diseases. But most importantly, we might use a short and controlled doses of glucocorticoids, also called as steroids, in these conditions. So whenever a parent or someone hears that steroids are being used, they get scared, and like they say they might go on to tell their neighbors or everyone that not to use steroids because it will harm the child. So, steroids do harm the children, especially growing children. But if it is used in a controlled manner with doses based on the weight of the child, and for a shorter duration of time, like with tapering, as in coming down on the dose every week and then stopping it altogether, it is not harmful. It can be less harmful. So, to control that overactive immunity, we might use steroids to begin with, but at the same time, we will introduce certain medicines that will take the action of the steroid. Once the steroids are stopped, those other medicines will take care of the action done by the steroid. So, with the controlled dosing, and also monitoring for the side effects of steroids, when used with minimal dosing and in a short period of time, it is more beneficial than being harmful. And also other medicines, as these medicines can be injectables used once in a month or so, or it can be oral tablets or suspensions once a week, or daily medicines. And physical therapy is very important. It is not only for the joint strength or the muscle strength, it is also for the overall general well-being of the child. One might think that if the child has arthritis, they might never be able to do all the physical activities they like any normal healthy child would do, and they might refrain from doing that so because of the diagnosis of arthritis. So, in fact, if a child has arthritis, one must urge them to do more activities than any other child, because these activities will not harm the joints. It will, in fact, control the inflammation. Once we do a lot of activities to any part, like if we walk a lot of, or if we run, blood circulation to that particular part increases. So if the child goes on to do a lot of activities, blood circulation to the joints increases. All those bad immune cells will be flushed off from the joint, and it also strengthens the muscles around the joint, so it gives a stability to the joint also, and also it helps in elating the mood of the child and overall well-being. And stretching is also important. Stretching, like as in yoga, meditation, and good lifestyle habits. Like there is a concept called as inflammatory diet and a holistic approach in inflammation. So we can't say like these foods are non-inflammatory, but we can certainly say that certain types of food can increase inflammation, and trying to avoid those food, or by including the good food, we can holistically approach these diseases. These inflammatory food can be the packed food that is ready to eat, as in cakes, cookies, biscuits, chocolate, and sweetened and energy drinks, and red meat, and many more. The non-inflammatory diet would be obviously fruits and vegetables, the colorful vegetables, and including healthy protein and fiber in the diet. With all this methods, and also with proper timely reaching out to the doctor and knowing when to reach the doctor, and not to ignore any of the subtle symptoms, and follow a thorough follow up during the management, one can completely control this disease, and we can treat this disease and keep it under complete control. And if you think that your child has any of these symptoms, do reach out. A pediatric rheumatologist is available in Chandray Rheumatology and Immunology Hospital. Thank you.